Okay, so good afternoon, everyone, and welcome again to another event of our Anti-Colonial Week. We are delighted to have Marta Caminiti today with us, and we thank her for joining us. For I think we are among usual guests of Anti-Colonial Week, so there's no need to repeat the framework of this event. However, welcome again. And let me just remind you of a couple of practicalities. As you are probably aware, this event was supposed to take place at the University of Vienna, although the premises were withdrawn at the very last minute. So let me remind you of the open letter that we've written to the rector and which is available on the tables in the back. And you can scan the QR code, read it, and sign it to support us. Um, Also, before I introduce Marta Caminiti, let me introduce myself. I'm Alessandra Guido. I will moderate this session, and I'm a member of the Forum for Anti-Colonial Inquiry in the Humanities and Social Sciences, which co-organizes the Anti-Colonial Week together with the student collective Univim for Palestine. We're particularly grateful to have you, Marta, here with us today, as Marta will be sharing her insights on a field that we have not yet explored in our program, namely that of global health. And the title of her contribution today is International Support to Gaza, the Actions of People's Health Movement and the Geneva Global Health Hub. Dr. Marta Caminiti is an Italian medical doctor and a public health specialist committed to global health policy for equity. She practices community medicine and health promotion in Italy, focusing on grassroots public health initiatives. Internationally, Dr. Caminiti is an active member of the People's Health Movement and serves on the steering committee of the Geneva Global Health Hub. In 2024, she was president of the European Network of Public Health Residents and a member of the World Health Organization Youth Council. Her work connects clinical practice, advocacy, and academic engagement to advance the right to health for all. We've chosen a flexible format for this session. So the conversation will begin between Marta and me. I will ask Marta a few questions, and then we will open the floor to a Q&A session where everyone will have the chance to engage directly with Marta. So to start, Marta, could you introduce us to the concept of decolonization in the context of global health? So why do we need basically decolonization in global health? Give us some background to understand how colonial legacies have shaped global health systems and practices.
Thank you, Alessandra, and thank you everyone from the organization. I'm really glad to be able to be here with you, but I would have been more happy to be in the room with you and, hear all the incredible things that were in your program. But therefore, yeah, we can start and enjoy this online session. I hope it can be engaging for you. So please, if you have questions in the Q&A sessions, don't hesitate. Yeah, it can be as flexible, as Alessandra said. I have a few slides, so I would try to share my screen. Okay. So the first question of Alessandra was why we need to decolonizing global health.
Just a second, because we can't see your screen actually.
Oh, no.
Okay.
I'll try again. Maybe it was uh, problem on my side. Now, better?
It's loading.
No?
Okay, yes. Now we can see you.
Yes, yes. Okay.
Okay.
Presentation mode. Yes.
Yes.
So
Okay.
Alessandra asked why we need decolonizing global health. So it's a very big question, but I had the support of many intellectuals that try to formulate this For example, there was this very good article from 2024 for Dr. Kumar that described decolonizing global health research, and they try to unpack what colonialism in global health is. And he saw different perspective of it to describe it. So colonialism within global health, colonialism of global health, and through global health. So we can unpack that. When we say colonies within global health, we mean who leads this kind of wave of colonialism in this field. So a few numbers to make you understand this phenomenon. So basically in 2020, the 98.7% of the $37 billion that were spent all around the world on biomedical research went all to high income countries. And in 2021, similar numbers like 82% also went to high income countries from like the benefactor, like Bill and Melinda Gates Foundation that gave grant fundings for research. So this reflects basically the inequitable global health research funding patterns that it's a mirror not only of the wider socioeconomic disparity between global north and global south, but also of all the disparities in the global health research system. So when we speak of colonialism of global health, means who is controlling this kind of mechanism, where the power is held at. So basically we have an extreme wealth concentration under the neoliberal globalization of resources. And we have seen the rise of this phenomenon that is called philanthrocapitalism that we will describe better later. But for now, we can define it as like a system where global health problems are framed as market opportunities from very rich people that profit from health issues and health problems around the world, giving money to specific health problems, hoping to profit for it. And this implied a shift from public to private financing in global health. This kind of pattern is very linked to promoting technology-based solution instead of systemic solution that can address the determinants of health and the causes of disease. You invent a new vaccine, a new drug that you can sell, you can put on the market, you can have a monopoly on it and profit from. And also colonialism is something that can be achieved also through global health. So who benefits from this system? We saw that there is an asymmetric funding structure that gives powerful states more power and private actors more money in the way that they have more opportunities to craft research in the global south and benefit from it financially. So one of the bigger, a result of this, for example, is the current unfair intellectual property right regimes that cover drugs. For example, I don't know if you are familiar with that, but it means that if I am a industry, a drug industry, I can I develop a new drug, or I just modify a little bit an old one. And when I create a new drug, a new vaccine, I can say, okay, this is mine for 20 years, and no one in the world can produce it, even though this could save lives. And this was happening for HIV, for hepatitis C, for COVID, and industry doesn't prioritize people's life, but profits. So they barricade themselves. Barricade maybe is an Italianism. they cover themselves through these walls of property rights instead of sharing knowledge, especially during pandemics or very, very harsh health issues across the world. I don't know why I don't see this image. Okay, if you don't see it, I can describe it for you. So basically, an exploitation of this phenomena was how during COVID-19, the industry Pfizer, for example, that was one of the main producers, as you may know, of the most used vaccines around the world for COVID-19, really more than doubled their profits, despite the vast amounts funds that created the drugs were from public institutions, for example, the state of UK or all other charitable funds. But then they became protected by intellectual property, and all the industry was profiting for it. And the global south didn't access the vaccines for a lot of time and couldn't be, it wasn't able to produce it. And the only way to having the vaccine was the industry or the global north or the philanthro capitalists say, okay, I'm very generous, I'll give to you some. So as you may see, this is a very problematic approach. So basically, let's try to understand the roots of this colonialism in global health. This kind of colonial health developed in the European colonialists. We go back to the 16th, 17th centuries when people coming outside Europe, colonialists said, okay, we see conditions that we are unfamiliar with, and they are a threat to our mission. For example, malaria. Um, People were like colonialists were dying from it, and it was seen as an obstacle to colonization. So treatments were a must-have, was something that they needed, and they felt was a requirement for colonial projects to succeed, giving them both to the colonial administration, but also like to the local population. So you may see that global health has evolved directly from colonial and tropical medicine. And the idea is that there was a design to control colonized population and make political and economical exploitation by European and North American powers easier. And this was the start, but many things changed in history, but many organizations that still are active in global health perpetuate this very concept, this very mechanism in different forms. But the meaning is that we have still a power imbalance that they claim to rectify, but they are acting on it through still colonial and extractive attitudes, with policies and practices that try still to concentrate resource, data, experts, all in the high income countries. So what we see, like the necessity for the global north to understand a new disease that sometimes is not new for the people who live with that, the new disease etiology, so the causes of the disease, patterns, treatments of indigenous population was usually, instead used against the interest of the people that were affected by it, of the colonized. So there was this kind of picture of colonial authorities that saw themselves as having the right solutions, in brackets, of course, and rarely considered that the people that were trying to help could possibly have their own solution, of course. Um, and not only that, but the indigenous forms of understanding of solutions were devalued and demonized and replaced with the technocratic experts of the science of the global north. So this is generating what is called the white savior complex. This is something even the Lancet wrote an article about. I don't know if you can, I don't know why in my screen I don't see the picture. I don't know if you can see it.
We can't either.
No, okay, I'm sorry about this technical issue, but it was a title of a Lancet article that is called like, "Are we training medical students to be white savior?" It's a title of a few years ago. So basically, what is white savior complex is a son of this colonizing aptitude in global health. So meaning we have depolitized, patronizing and charity-based approach to global health issues where white people who see themselves as helping and rescuing people who are not white, are suggesting people are unable to deal with the problems themselves because it is done in order to make, or another question, another situation is white people do these things because they make the white people person admired. So it's more like not about justice, not about really trying to help, but more about a big emotional experience that validate and confirm the privilege that this kind of group already has. So in this bigger picture of global health, we have some guidance. Fortunately, we have this big organization that I think you may know, the World Health Organization, that is part of the United Nations. Is the is the health arm of the United Nations, and it has this mandate to provide leadership, strengthen government, and foster partnership and collaboration within countries, the United Nations system, and other stakeholders to fulfill the mandates of WHO in advancing the global health agenda. So basically, they have to guide us, they have to lead us, and put all of us in connection in a safe environment where all member states can reach, and improve their health members. But who finances WHO? Who has more power? It's true that all member states, so every country that pays the fee of the United Nations to be part of the World Health Organization, has one vote. So every vote, every nation counts one, but not all the nations give the same amount of money, for example. So the power shift is still there. This is from the WHO website that is very easy and it describes the two main sources of financing from the WHO, for the WHO. So basically, member states, there are the nations that are part of WHO, pay the asset contribution. So the fee that they have to pay to be to be a member. And also there are some voluntary contribution that can come from member states, but also from external partners, stakeholders, intergovernmental organization, private sector, and other sources. So let's see asset contribution. These are data from, I think, a couple years ago. So I was at the letter I, because I'm from Italy, I was looking at Italy. So this is the screenshot of the I letter, but it's like to let you see ideally an orientative amount of money that each state gives to WHO every year. But here you can see them in 2020, like in order grading from the bigger contributor for assessed contribution to like in the first, I think, 7th position, because as you may have seen, there is a specific way to calculate the assessed contribution. So every member has to give a percentage of the country's gross domestic product. So of course, richer countries has to pay more. So you see United States, $115.8 million per year, and then the others are way less, and these are still the bigger contributors for assessed contribution. So this year, something very big happened, meaning that January 20, Trump decided to withdraw the United States, that was one of the founding members of WHO, from the World Health Organization. This had an incredible impact on all the world, the agenda of the WHO, because as you may see, it's a lot money that is going away. So many programs were defunded. Many people were out of nowhere, didn't have a job in Geneva, in the headquarters of WHO, but also all around the world, in every member state's office. We have also voluntary contributions. So people that want to donate, and as we said, we have a lot of rich people that wants to be a little bit white savior and like give a lot of money to health, hoping to profit from it. For example, you may see the amount of money Bill and Melinda Gates Foundation are giving, or the World Bank, or Rotary International, for example. The Gavi Alliance, there is an alliance related to to vaccine production. So basically, they are connected with the industry of vaccine production. So what does it mean to have voluntary contribution? It's not like I'm a member state, I give you my fee, and the World Health Organization can do anything they think is fair to do. No, if I give you more money, I'll tell you where you should put that money. So I'll give you $100 million, but you have to put it in polio, in vaccines for polio, or in treating TB, tuberculosis, for example. So in the 90s, this vertical health program arose. So vertical meaning you have money and you can spend it just on that. Um, and this Lancet article that is from a few years ago already described this phenomenon as the desire to see measurable results from capitalist organization of power or powerful member states to see their investment, with specific objective, target to specific health programs, not systemic approach, and often based on specific technology to profit from it. So this is different from classical philanthropy. So a philanthropist, what does he do? He's close to the community. He values the relationship to the nation of the community that is giving money to. And it grants freedom of action to who receives the donation. On the other hand, the philanthrocapitalism is described by the fact that the entrepreneur describes who and how they have to spend the money on and create monopolistic positions. And this gives more power, and they are more powerful where they can fill the gaps left empty by politics. So there were written many books on that, uh, on philanthrocapitalism, for example. This is a quote from Nicoletta Dentico, Geneva Global Health Hub co-president, that says, while traditional billionaires are content to buy themselves an island to be happy, Bill Gates has aimed to buy an entire United Nations agency. So he's actually managing to do it, and that what's even more serious, that the international community is letting him. And these words are very strong because, as you may have seen, they are giving much more money than any states and then more than all the member states put together. So they have a lot of power to decide what a UN organization needs to do. This was very evident through COVID. Bill Gates had a lot of saying to the decision of Pfizer and World Health Organization, and did a very strong campaign for vaccination, for example, and but keeping the framework that we described before. Intellectual property is not going down because it was asked that intellectual property was banned for pandemic, and all the global north, including philanthrocapitalists and the industry, was totally opposed to that, even during a pandemic, even when people were dying worldwide, and they were profiting from it a lot. And now in these days, this is a news from few weeks ago. Money is still lacking in WHO, so the US presence is really missed on their side. And so a new horror is beginning. Basically, they are creating a new space for discussing financing global health, but outside global health, outside WHO and not inside. And the idea is to create this coalition when the World Bank, that for sure will prioritize profit over people, is involved and has so much power, so much more power than before. So a new wording that seems like the language of colonization, like freedom from priorities of donors from high income countries, will probably be all the old nonsense with a new name, but old system. Back to you, Alessandra.
Thank you. Sorry, I was just checking technical stuff. But no, thank you very much for this very rich overview. And it was very useful, I think, to walk us through the topic. And in this second part of your talk, I would like to focus more, yes, as we discussed, on your activity and your experiences. So you've been part in the last few years of People's Health Movement. You're part now of the steering committee of the Geneva Global Health Hub. So maybe to start with, please give us a brief introduction to these movements, what's their aim, what they are generally, what's the history behind, and in order to focus later and more broadly on what your activity in this movement is actually involved in terms of concrete actions of advocacy, policy, and activism. So please.
Of course, thank you, Alessandra. So basically, when you study all these mechanisms that we spoke about before, and when you live in a time of a genocide, live streamed in our face as we were in the last couple of years, I, I think we all felt speechless, powerless, helpless, overwhelmed, and all a lot of other vocabulary that cannot be named even. But I think that really associationism, organizations, movements can really give us the power, to come together and even face bigger problems that seem impossible, to approach. And this was why I got near the People's Health Movement. There is a global network of grassroots health activists, civil society organization, academic institution from all over the world, and it was basically born in the global south. And the aim is to democratize global health governance. Inside, we have people from, I think, 70 nations. So we have a lot of programs. So I will describe just a few of them, and then, as Alessandra said, I will be go more in depth of my experience. So one of the main gatherings from People's Health Movement members is the People's Health Assembly. The last one was in Mar de la Plata in 2024, and it's a way for all health activists around the world to come together. And last year it was about the struggle for health. It's a struggle for liberation and against capitalism and imperialism. So very close to the topic that we are discussing today. They created this call to action that you may find on our website in case it can be of use for your activists as well, for empower all the people you want around the world. Another very big project is the Global Health Watch. It is it's a book basically that is being published every 3 or 4 years that critically reports on the state of the world's health. This one, number 7, was out in October 2025, so it's our new baby, and it comments on the development of global health while focusing on the past popular struggles. So I think more than 100 people contribute to write this because we really wanted to convey the voice of people around the world in every state, especially the global south. So it reflects all the condition of people in the context they live them, and also it gives a little bit more. The topic of this year is mobilizing for health justice. So also we concentrated on progress towards greater health justice. I say we, but actually it was because of a sense of belonging. But I cannot say that I had the pleasure myself to have written this. But yes, the People's Health Movement had this view for this project. Another big project of PHM is the WHO Watch. I am a regular of this since 2021, when I started going to Geneva, to the headquarters of the World Health Organization, to following the work of this United Nations Agency of Health. So basically, People's Health Movement enable a team of volunteers, young activists mainly, to participate to WHO meetings, especially the World Health Assembly and the Executive Board meeting. They are the bigger one where the policies are approved. And the goal is to understand the direction of health policies, engaging in advocacy within the WHO, communicating the content of meeting also to civil society. So it's not only to go there to speak our truth, to speak our advocacy, but also to take what happens inside these very closed walls and convey it to the civil society outside. So we do a lot of writing, policy reading, meetings all days, translating by night in 3 languages. So we try to do this double work. And the picture is from 2023. We were a whole women team. It was fantastic. And the one on the right, on the left, was this year's team instead. Another project that I'm really fond of, because like I started it after going to the WHO Watch. I met fellow activists and we discussed a lot the systemic inequities that are perpetuated by capitalism and imperialism, especially in the access to medicine. And so we thought that someone needs to start this. Maybe it was to have a high goal, but we started this kind of small movement, and now it's getting bigger and bigger, of asking for a public system of research, development, manufacturing, distribution of health technology. There we were in Brussels last year in an event, our first event that was patronized by the European Parliament, and now we did another in Scotland, and the movement is getting bigger, and we hope this project will really lead to a transformative mechanism, to realign the health system with human rights, sustainability, and also a collective well-being of communities worldwide to have high quality and affordable medicine. These were us at the end of the workshop last year. And also, like, we managed to have a side event during the World Health Assembly this year in Geneva about public pharma. We were hosted by the Doctors Without Borders official office. So we were really happy to be there, because Doctors Without Borders was led so many battles for access to medicine. We decided to have this kind of manifesto with the world turned upside down in order, to realize the importance of changing the perspective and changing the order of power. And the title was Democratizing Research and Development, Ownership and Access to Medicine in the Global South and the Global North. Another PHM big column is the International People's Health University, IPHU, meaning that every year PHM is organizing learning, sharing, and planning opportunities for people's health activists, particularly from the Global South. And also in 2024, the topic was confronting capitalism and imperialism in the struggle for health of people and the planet. So you may find it here if you want to scan the QR code, or you may find it, of course, on PHM website for your consultation, since it's a topic that may be of interest for you. And then Geneva Global Health Hub, it's a bigger umbrella. It includes PHM as well. And it is a network of 43 civil society organizations, universities, richer countries, social movements, and individuals coming from all over the world and engaged in global health. And this is the steering committee that is in place now. So basically, G2H2 wants to provide an independent space for civil society that engage with the United Nations advocacy in health, to meet, share knowledge, create initiatives, and advocate for more democratic global health governance. For example, I think this is a very concrete example of actions of G2H2, very simple, but like, we were in Geneva in May this year, and we were from all different organizations that are activists in health, that we have a kind of an allied view, but we advocate maybe for slightly different things. And the G2H2 creates space for us to meet, coordinate, and be more powerful when we have to advocate with member states to influence all the policies that are going to be voted. So also G2H2 organize a lot of events. These are, for example, one of the two later latest that we did, Global Public Health Needs, Economic Justice Now, Defining Public Health. So I could have had a very full slide, but just to give you an idea. And also, this is another project of G2H2 that I'm very proud of, because we started this in a coalition where also PHM is very involved. That is Stop the Pushback on Women's on Women's Rights. We launched it this year in Geneva last January. And I think all of the women that were active in these organizations were brought to the attention that really wanted to act on the alarming attacks on women's rights in multilateral space that we were assisting, including the WHO and the United Nations institutions, because we saw that as a sign of the escalation and the global attempt to undermine women's role in society. From like in many different areas, the denial of sexual and reproductive rights, the weaponizing of women's body in conflict zones, the widespread violence against women, and patriarchal forces all over the way that targets the agency and the freedom of women. So the idea is to challenge this regression in a way that can transcend borders, and we can colonize all around the world building this movement. So Geneva Global Health Hub really wants to build.
Free to
Oh,
remind you
sorry.
the time. No, just
Sure.
because, okay, I think we have time until 5, and I just want us to have enough time to delve into your experience and etc. So maybe,
Thank
yes, peak.
thank you for the reminder.
No
For the
problem.
reminder, I'll be quicker. I get transported. Uh, okay, so part three. Do you
Yes.
want me
Okay.
to go? I'll leave you the floor.
Yes, okay, let's go to part 3 then. Yes, so let's delve more into your personal experience and activities since you joined PHM. And yes, I would ask you, since over the past few years you've been involved in high-level advocacy at the UN, including, including the UN General Assembly, could you tell us more about some of the most important campaigns, statements, moments you've witnessed, and specifically, I think here we'd love to hear more about your work concerning the case of Gaza.
Okay, thank you, Sandra. Of course, let's dig into policy and advocacy. So regarding G2H2 and Gaza, from the beginning in 2023, after a few months of the attack, we already like send out a powerful statement, but steering committee, where we call out the hypocrisy and demand ceasefire. Like it's been 2 years. Many organizations were silent in the beginning. You can remember the first time where there was a lot of, oh no, but also Israel, oh no, but maybe they were attacked. But like we tried immediately to take position, asking permanent ceasefire, ending the double standard regarding the efforts to uphold the respect for international humanitarian and human rights law, and also like a rapid, stop of the grave violations of international law that were happening by Israel. We also like created in 2024 a space, a workshop in Geneva where civil society activists could meet and give a common reflection aimed to address the shared sense of impotence and grief, looking at all the destruction that were going on in this world in flames. This is how we described it. So it wanted to be a bridge between, the analysis and challenges of humanitarian workers in conflict zone, and also the traditional policy debates of civil society. Also in July 2025, as you may know, the eight group in Bogota met. I think you're familiar with them, but they are a block of countries that was established in 2025 that coordinated a legal and diplomatic action against alleged Israeli violation of international law in Gaza. And we wrote an open letter to all of them where we like hailed their proposals, namely, I'll be quicker, but I can show you the slides, preventing provision of transfer for military equipment to Israel, urgent review of all public contracts to prevent public institutions and funds from supporting Israel, illegal occupation of Palestine, complying obligation to ensure accountability for most serious Israel crimes, etc. So, and we also stressed that we thought that the international community should consider advancing the suspension of Israel credentials at the United Nations, so kick out Israel after what was doing. And also we sent another letter to all the European parliamentarians saying the European Union is dying in Gaza. What are you doing? What you are not doing is making you die in front of our eyes, in our hearts. We don't feel represented with this institution if this is how it is not acting. So you may read all the full statements. I leave you the links and the pages. Also, PHM has a very strong connection with Palestine. Three organizations are members, Palestinian organizations are members of PHM themselves, Health Work Committee, El Awada Health and Community Association, and Palestinian Medical Relief Society. So we did a lot of initiative, never enough, but like we try to commit in global health advocacy, organizing webinars, panels, gatherings, and also in bottom-up initiatives. Regarding policies, that is the topic of this part. During this World Health Assembly in May, where we were in Geneva, we created this big document, policy brief, with all our hot takes on the policy that were going to be approved in order to support the Global South delegations that have very, very few people that had to follow 1,000 things, could not be in two places at the same time, and give them support. Like, I already read this is a commentary, please trust me. This is something that you can use for voting. And two of our main parts were on the agenda items on Palestine, air conditioning in the occupied Palestinian territory, and air conditioning in the occupied Palestinian territory, including East Jerusalem, in the occupied Syrian Golan. This was our statement on Palestine. We wrote three, and we read out loud in that room you may see there in front of all the delegations in order to influence all the, the voting procedures. What we experienced in the very room where things were discussed by member states is that when the few years ago discussion were on the between Russia-Ukrainian war, there were words very, very more condemning of the Russian behavior by the global north, and like that Europe, Canada, America had a white savior approach also towards Ukraine. And on the other hand, with the Palestine-Israeli conflict, there were very shades of gray, lesser words. No one has spoken of genocide before May 2025, the year where it was the first World Health Assembly where the United States were not there. And I think that mattered a lot. What was voted? So the measures were adopted in favor of Palestine this May at the World Health Assembly, meaning that Palestine was notified within a very important document, the International Health Regulation. This has a lot of, consequences, but we will describe it as a good, positive thing for recognizing the health rights of Palestine, and also a symbolic thing like the flying flags of non-member several states of like Palestine could fly over the headquarters of WHO for the first time. But what was uninjuring was that we heard with our ears the Israel delegates saying Israel does not target civilians, Israel does not target medical or humanitarian personnel, there is no famine in Gaza. There was still in this May this kind of narrative about this. PHM also a shifting topic, try to support a lot the local, hospitals and realities in Gaza. And we delivered another big policy moment during the year are the United Nations General Assembly that are happening every year in September, every year in New York. And we launched these very big statements published in the Lancet, When Health is a Target, a Global Public Health Call to Action in Gaza. And you might have seen this kind of images. So during this kind of big gathering, the United Nations General Assembly, during this atrocious Netanyahu speech, many of the members just stood up and for the first time left the room. This was an unprecedented thing happening at the United Nations. And we tried with G2H2 to cover like discussion and critical thinking about this after the event. For example, with this webinar unpacking the political economy of non-communicable disease, that was the main topic of the United Nations General Assembly this year. All this and more policy work that we did, we hide and we treasure it in this WHO tracker. So you may find it online and search for a topic that you are fond of it, that you are interested in, and you can follow it through the years. Powerful.
Thank you. No, I think this was, I mean, connects very well also with all the previous events that we had at the Anti-Colonial Week. We talked so much about narrative, distorted narrative about the Palestinian-Israeli conflict, and it was, yes, I think very fascinating. I mean, also to see how this kind of narrative shapes also the politics of global health. And another topic, yes, for the topic we chose for the fourth section is also something that I think resonates deeply with us during Anti-Colonial Week. Namely, I'd like you to talk more about your commitment to direct field activism and the ways in which you've worked to raise awareness about your campaigns. And it resonates with us because, you know, while Anti-Colonial Week per se is designed as an academic event, many of us is also engaged in activism and at various levels, and we stand in solidarity with efforts to amplify anti-colonial perspectives and make our demands visible and impactful. So please tell us more stories about this.
Of course, I think policy action is very important. Give out or speak out in official settings is important, but also like the most heartfelt thing that we can do is coming together and really express of our power coming together for a cause that we think is right. And we have way more power than we can imagine to have all by ourselves. So the PHM did a lot of grassroots and bottom-up initiative. First of all, we had 3 PHM members on the Global Summit Flotilla, and you know, they were also at the end beheld by the Israeli force when they landed. But like they, for all the travel, they like gave through all the way information, updates, and we were following them. You know, this was on the 24th September, very few like days before arriving, I think a couple of days before arriving, our activist that was like Aziz Rahali speaking out and describing everything that was happening to give testimony to make civil society more involved and involved. Also, like during Model Assembly, we decided not to go just with statements, but also with more, creative pattern of advocacy. This was one. So basically, me and Juliette, another fellow activist that you may see on the right, decided to go into a store in Geneva and buy like 100 toys for kids, and we put them in our backpack and we try to to enter it in the United Nations Palace for the World Health Assembly. And so basically, we disseminated all these toys all around. We bring them with us. When we were speaking and doing statements, we had our toy with us. And people were just coming and saying, why do you have a teddy bear with you? Or why do you have a bunny? And we were saying, do you know that due to the blockade, toys are not entering Gaza for 13 years? And then it was a starter for conversation. We were highly recognizable, and we did not have to go to people and talk, but it was a way to break the silence because, you know, it was an assembly where in the official room, we were speaking about Gaza in some moments, but then it finished the session and then outside business as usual. But it was crazy. It was insane, you know, after what was happening. And another way we had to break the silence, this was more complicated, was to cut a lot of watermelons, put in our backpacks as well. It was very hard to pass security because when they put it on the X-rays, they wanted to arrest us, but they didn't have to, fair reason to arrest us for or preventing us to enter for watermelon reasons. But then we just went outside the cafeteria where people were getting lunch or coffee without any sign. People were just grabbing their, watermelon, eating it, and bringing symbol of the Palestinian fight all around the palais, even when people was not speaking about that. So also the delegate from Palestine came to us, started crying just before the session of the discussion, and we could see that this action may seem maybe silly from a visual point of view, but like had a very strong power in putting all the people in the room in reminding them the importance of what was happening and not ignoring it. Also, we did a lot of manifestation. You may see with the rain, with the sun. We were, painting the things in our balcony, printing stickers that we disseminate in all Geneva. And all these manifestations were made in front of the United Nations Palace in the main square of the policy of global health. Also, PHM has a very interesting gallery of pictures of health workers attacked and harassed on their website. This is very interesting. It's a kind of way to make awareness on how this repression is a really high violation of international humanitarian law and how we should protect health workers around the world. And of course, we have a specific session on Gaza doctors and health workers. Also, we participated in initiatives similar to yours. This was more of a concert, festival, manifestation, but like for young people to getting together, empower themselves. This was in Belgium, and many testimonies of the Gaza experience were shared. We just launched fundraising for Gaza for the three organizations that are part of PHM that I told you about. So feel free to check that out if you're able to sustain it. Of course, we are really happy. They are just organizations that are based in Gaza, in Palestine, and they need support now. So just for conclusion, I already said that, but really, people's action have transformative power. Our Prime Minister said when we said that we were going on a national strike in Italy all today, in the same day, she said, oh, they just want to do the long weekend and stay home and have a long vacation. And then we represented how many we were in all the city all at the same time together. This was really strong. And it really brought me that a lot of articles were coming out in Gaza. These scenes of Italian solidarity spread from phone to phone, bringing a ray of hope amid the rubble, hunger, and bombs. So thank you for your attention. And all questions are welcome.
Thank you, and please thank Marta for her thoughts.
Oh, thank you.
No, this was a very fascinating. Let me just say I like the reference to the general strike in Italy also because it's not the first time that it comes up during Anti-Colonial Week. So as Italians, we're of course quite proud of it. It was also mentioned by Ramzi Baroud in the first lecture of this week. And it is a really good example, I think, of how yes, people's actions can really change the course of events. Yes, now it's time for Q&A. I would like to open the floor for questions from the audience. If anyone has any thoughts or reflections, also online. So to the people online, you can either write, text your questions in the chat and we will read them, or you can virtually raise your hands. Okay, we have a question. Do you want to come here and Thank you. You can come here at my place.
Hi, thank you so much. One thing that really stuck out to me is how there is so much power in the finances and how capital is unevenly distributed. So, with that in mind, how does the People's Health Movement deal with these challenges, with this uneven capital distribution? And where does that tangibly show up in your work? Thank you.
Thank you. This is a very big question, and is we really, as activists, have in our heart to not always speak about money and just bring the discussion to that. But of course, as I did say in my presentation, it's a big chunk of the pattern because we are the thing is that um, we discussed this in the last steering committee with our colleagues. We can keep finding new, uh, new small solutions to problems, but if we stay in the same framework, economic neo-capitalist framework, we will not address the situation. So, as PHM, we are trying to push very much this this change, this to turn the table upside down and really try to change the narrative, to change the structure. So very concrete projects, for example, to work for, in my opinion, for example, are intellectual property rights fights for accessible drugs, and also like um, we had a lot of advocacy and political fights for convincing member states to be more responsible and try to raise up their assessed contribution. Because if WHO became strong again and keeps and take their money from the member states that are their people, and they do not say, okay, I give you this money, but you have to spend it in that, but just the WHO can retake the authority to decide what are priorities for the health around the globe. So this is a very strong line of activism that we try to do. And also this is something that Dr. Tedros, that is the current the general director of WHO, is following, probably because he's very afraid of not having money. So he's moving not only in that direction, not only to force member states to rise up their contribution, he's also asking for financial capitalists to help him. So it's not like, he's the director, he's in the balance of this system. But we really advocated for this, and it was a very big win in the last two World Health Assemblies that this happened, was voted, and the assessed contribution of member states were raised up for 2 years in a row. Also, the public pharma, I think, project is a very complete example of trying not to see the problem and create a solution to that problem, but to say, okay, we have to dismantle the system and propose a new economic system to do that, a new institution. Like, for example, I couldn't speak about that enough, but in Europe, we have the ESA, that is the European Space Agency, that is public. So we have something similar, for example, for that. We have CERN in Switzerland for physics, research in physics. So we have similar concept, and drugs and access to medicines are as much important as space or physics. So the idea is we are involving not just heartfelt activists, but like economists, people that are studying law, intellectual property rights on a jurisdictional, level, and we are trying to propose a really concrete new system and present it to the European Parliament. We are starting in Europe, but also like Colombia is doing a lot, Argentina, Brazil. We try to help each other and having a network of coordinated action on this. But yeah, I'm happy of the question because it addressed exactly our concerns and our, you know, our efforts, the direction of our efforts.
Thank you. More questions? Yes, maybe you first.
Thank you for
Hi.
that. So I would basically be just following up from your answer to the last question, where you were speaking about the patent rights and all. That was really interesting to me because in like basically because in 2005 when India had to sort of like reform its sort of patent rights from a more of a process-based patent to a product-based patent rights because of WTO rules and all. There was it was one of the major concerns that the thriving sort of generic medicine industry, which has been sort of present in India for quite some time, would be quite fundamentally harmed. And although, I mean, people would say that there are safeguards present in place in the present sort of patent laws, I still think that was one of these sort of moments where, like, ultimately the affordability of medicines in India kind of was ultimately harmed by the change of the patent laws from the more of a, yeah, from the moving from a process-based to a product-based patent regulation. So when you said about uh, the reforming the debate around IP laws and all, that was like really interesting to me. The other point I kind of want to touch was when you said initially the sort of colonial background of the sort of the field of like tropical health. I think in a way it's funny how it kind of still remains in the field of the neglected tropical diseases specifically, where quite often so much of the discussion is centered around the solutions in terms of like magic bullets, but we do not really talk about the sort of processes around it, like in terms of like poverty eradication and all, which probably is, I mean, you probably be able to explain this better, but it's kind of like recognized that they often play a equal or if not sometimes a more significant role in meeting these type of challenges, but I don't think that is talked about enough in terms of like the research priorities and the research goals, basically. Thank you.
No, thank you. This is really interesting and gives me the opportunity to speak of very interesting and important topics. So India was for years the pharmaceutical powerhouse of the world because of their incredible system that allowed many countries that had barriers, intellectual property barriers, um, to go and ask, can you help us produce this kind of drug? And India managed to create this commerce of solidarity and accessibility of medicine all around the world. So you may imagine how much it could have been targeted from the World Trade Organization. The World Trade Organization is another big international organization that manages intellectual property basically on everything. But of course, the drug section of it is very strong, very powerful. And it's also the one that I'm more, of course, that I know better. Um, India was becoming a public enemy number one for them because they were India was destroying all the barriers that they were putting high. So it was terrible the pressure that they put on India, and then at the end they were forced to change their system, as the colleague, the student, I don't know, in the room said, and I think this should make us understand how much it's important to take inspiration from systems that work and that support the global community, as there was the Indian one. And also, I may add that Indian activists on health and access to medicine are the stronger and the more generous in terms of intellectually supporting in sharing how was the system, how can we can rebuild it, how we can reshape it. So I think we really like we really owe India a lot in terms of that historically, and also now in the fight for access to medicine. Um, Also, like regarding neglected tropical disease, I was happy to hear that the person who spoke had a very good insight on the topic, but I'm not sure all the audience could have it. So basically, they are called neglected tropical diseases. So diseases, so they are some illnesses around the world, infectious usually, tropical because they appear usually in the tropical areas of the world mostly. But the important adjective, the political adjective, is neglected. So they are forgotten. Why? Because, or sometimes few people are suffering from it. So we don't care if they die. So sometimes, but most of the time is because people in the global south suffer from them, just in the tropical areas and not global north. So, for example, there was a very crazy example. I think it was the early 20s. I don't remember what the drug was, but like there is this disease about there is like malaria can be transmitted to zanzara, how do you say, mosquito, and people were dying from it in many parts of the world, and many people were suffering very high, very strong neurological issues, or even die from it. And there was this drug that was produced by a drug company in the north, was very expensive, was donated sometimes, and at some point the the pattern, the patient, how do you say, the patent just stopped. They did a 20 years of patent, and the industry said, I don't think it's profitable anymore. Like they don't have the money to buy it, to give us a lot of money from it. So we just stop to produce it. So people that had in the world, like the mankind had the idea of producing it, it could have been produced, and just it stopped existing and people were just dying. And 1 year later, we had some kind of drug or pharmaceutical thing that had the same chemical component, but was used for making your hair better, like stronger, for example. So we had this incredible paradox when we had been producing the same chemical thing, but not in a way that was saving lives, but in a way that in a very unuseful way, but very profitable for high income countries. So this is a very hard topic, and this was very also linked to the vertical programs. So like I give you money, like I finance WHO, but also for only for profitable diseases, or for diseases that make me appear like a very big savior. For example, thousand billions, trillions of dollars for years and years and years were given to polio vaccination from Bill and Melinda Gates, the Rotary organization, WHO. Why? Because it's the disease that we are closer to eradicate. So we imagine if the newspaper Bill Gates eradicated polio, woo, savior. But of course, it never worked. Even if the disease where people were give them more money to in all the history, basically, this is an approximation, but it's a ton of money. Why didn't work? Because you cannot cure or eradicate polio just vaccinating people, because it is transmitted orally. So also if you have infected feces that goes into a water system that is not hygienically right, you cannot contain the infection. So you have to properly address the territory, the communities, make a better water system, give protection, hand hygiene. These are things that help a spread of polio survive also vaccination. But if you use just a product, I think that you can profit from. It doesn't solve the issue. So thank you for the question, because it helped us think about a lot of other systemic problems. Did not make us very happy, but makes us discuss more things.
I think we had another question by Oscar. Yeah, you have to come.
Hi, Oscar.
Hello. I wanted to ask, because health workers have been pretty much the only outside witnesses of this genocide in Gaza for the last 2 years. And what has been the response to those witnesses and the thing that they were describing in the statements from these global health organizations and from the global health community? Would be interesting to hear how the responses were, and in general, how health workers are the ones most involved in witnessing these global injustices around the world, and how the world responds to these people who are, because usually we always talk about, we want to hear from the experts, we trust our experts, but in these situations we don't really see any response to this.
Thank you. This is also a very heartfelt and strong part of the section of the topic, for sure. So health workers in Gaza, especially in Gaza, I think is the main focus, but it can be generalized, of course, of other warfare situations. So in this live genocide happening, many of the workers were already there, so they didn't kind of choose to go there, but still they decided to stay. And I'm sure you may have heard or seen testimonies of doctors, of nurses that recorded videos and said, okay, this could be my last, testimony, but I'm staying here, saving, I don't know, 3 small babies at the same time, or waiting for the bomb to arrive. And also there were a lot of other workers like coming to Gaza for support. Not that much because it was very strong, but there were people also with the flotilla. There were people coming and trying to support. What was the reaction of the other institutions? So on one hand, denial from the other side of the barricade, as we saw, there was a complete strong denial, even in very recent times. From Israel, the narrative is that hospitals were not targeted by Israel. That is all a conspiracy from the Palestinian rebels to make Israel appear bad. And so it was excruciating hearing that kind of narrative during also official situations. And then we had, for example, civil society organization that tried to empower these voices. So, for example, we tried to connect with them all the time that we could, but also like for them, internet connection, video connection, where resources, power was really hard to get. So, but we try to organize webinars and hear people from them. In Geneva, we organized during the World Health Assembly a side event where we connected with doctors in there that were speaking about the situation. And there were inside the room the special rapporteur for WHO about Gaza. And he was describing, and he was coming and going, I think, once every 3 weeks, 2 weeks to support direct. But there was this kind of, when the official rapporteur of the World Health Organization is speechless in a room and has shivers while hearing, the connection with the doctors there. I remember this event, like very, very, was a very, very powerful moment. We tried, as I was saying, to, I don't know, hear from their experiences and putting them in write and share online their testimonies. We manifested especially for health workers in Geneva, and we printed all their history, all their names, all their pictures, and shared their stories. And I think many other organizations. There is a very big circle that is called the surgical. I don't want to mispronounce the name, but basically it's the Global Surgical Support for Gaza. There is a worldwide organization, and they scream their heart out every day. I think in the last 2 years, defending the rights of the health workers. Because as we were saying, if you target the healthcare facilities, if you target the healthcare workers, you just attack humanity, the humanitarian right to life, to live a life. Because if you don't have anyone that can support you, you are just really want to exterminate a population, and this is not acceptable in any way. So I think there was a lot of respect for this. I'm a doctor as well, but I was not in Gaza. I cannot even imagine what could have been a day, even just a day in there in that situation, and a lot of respect and as much support as we could, also to not only help them in any way we can from us from far away, but also like empower, like not empower, spread their voices and their story and their need, because it was important to hear what they needed at the time, what they wanted, and maybe be a megaphone to share that around the world in our channels.
Thank you. More questions? Okay, then I think we can wrap this up, and maybe I'll take the time just to announce a few more events that we're upcoming events. But first of all, let's give Marta another thanks for being here, and
Thank you all. Thank you. It was my pleasure. Really.
all
Next time with you in the room.
next time in presence, hopefully, yes. So yes, in the tonight and tomorrow we are still going on with our anti-colonial week. We have a movie screening tonight at 6:30. The movies We Will Remain, with also with a discussion afterwards. And tomorrow it's a very creative day. We will have a creative workshop on Black poetry in solidarity with Palestine. So we go on with this thematic thread, the spoken word night with Shefali Beneri, and also an artistic installation in the same place, which is I forgot the name of the place, and it's not on the flyer. Vinci Rast. Okay, thank you, Robert. Yes, so hope to see all of you in the next events, and thank you again.
Bye. Thank you all.